Oh, John, I'm sorry we had to cut you off before you got your question out. What do you got for us?
Well, I'm not sure there's anything that can be done, Doc, but my equilibrium is so bad. I slipped and fell the other day just flat on my face, but I try to walk straight. I can't even walk straight lines, so I'm getting up there in age, but I'm just wondering if there's anything I can do.
What have you been diagnosed with, John?
Well, I've had a heart attack, surgery, have a pacemaker, defibrillator, and I've got the tremors real bad.
Okay. Has anybody talked about positional vertigo with you, or vertigo at all?
No, they haven't.
So tell me, does the room spin when you get up?
Does what?
When you feel like you're going to go down?
Oh, yeah. If I start too fast, I do get dizzy quite easy.
Are you being treated for vertigo?
No, I'm not. I've never been diagnosed with it.
Because that's what it sounds like to me. It sounds like positional vertigo. How is your blood pressure, John?
It's pretty darn good. All the medications, everything, I think it was 130/70 last time.
Well, the blood pressure is good, so it's not a blood pressure issue. Do you have diabetes?
No, I don't.
Okay. How young are you, John?
Well, about 6 weeks, I'll be 81.
Well, that's a tender young age. And how long has this been going on, John?
For the tremors for quite some time, but dizziness and equilibrium, year and a half, 2 years.
Let me ask you this. Was there an accident? Did you fall? Did you bump your head a year ago?
No, I went through a little trauma. My brother died, and 6 weeks later, my wife, and same year, my sister died too, and I've lost about 100 pounds since then.
Okay. Are you eating well now, John?
Yes, I do.
And other than the tremors and the dizziness, do you feel relatively healthy?
Well, I can't walk very far, to be quite honest.
And are you being treated for any of this right now?
Well, the COPD, I take oxygen every night. I've got, I think that's what it's called. I put some liquid in a thing, turn it on.
Uh-huh.
That's not what it's called. It's called something else. I can't really remember what it's called right now, but you put a tube of clear liquid in this thing and breathe it in, and it relaxes your lungs some.
Well, I tell you what I would have you do, John. Our phone number is on the screen.
I see it.
Would you do us both a favor? Give me a call at the office tomorrow. I mean, you have absolutely nothing to lose and everything to gain to come by and let us take a look at you.
That sounds fine, Doctor.
And you know what? We'll see what we can do about getting you back in the ball game, okay?
Sounds good.
Thank you for your call.
Thank you.
So it sounds like positional vertigo, which sometimes is an inner ear. he's had no trauma other than emotional trauma. And that, which,
Emotional trauma is huge, though.
yeah, it is. I mean,
Yeah.
3 deaths in 6 months is big.
Yeah, yeah.
So we'll have him come in and we'll report on him next week if we have success with him or we don't have success. I'm trying to remember where we were with you though. When you're the deep tissue treatment that LD received the first time in the office. And what that deep tissue treatment does is it breaks up the scar tissue, brings in the blood flow, increases the flexibility. And I remember that day. I remember the Monday when you come in and you raved about that young man's talent. And it was right after that we went out and hired a trigger point person that is very good.
Phenomenal.
And she's excellent at what she does.
Can I take a minute to describe what she does?
Can you do it in a minute?
No.
All right, go ahead. We got 13 minutes, go.
Well, when this young lady was hired, and the first time I went in to be worked on by her, you lay down on the table and obviously you got a back problem. So she wandered around my back and identified quite quickly a group of problems, and as she described them to me, these muscles had pulled into knots, and that was pulling my spine, if you will, out of line, which is why in the 8 months up to then, you'd get me all lined up. Sometimes I wouldn't even be home, and already things would start going wacky. So she explained to me that these muscles had these knots, and she said, I'm going to press on this until you can't take the pain anymore. And then I'm going to hold it, and you let me know when the pain goes away, which is real quick, 30 seconds or so. And she said, then I'm going to press on it some more until it hurts again, and then it'll go away, and then I'm going to do it some more. And I don't mind telling you, Doc, for about 5 or 6 weeks, I hated going into that room. That was painful. Right off the bat, there was 5 muscles that she was doing this to. And so 5 individual muscles that, and I'll tell you what, folks, you literally want to go through the roof, you want to scream, but the male menopause thing doesn't allow you to do that, So anyway, eventually it got to where it didn't hurt much because they were not knotting up. And as that happened, my back started staying more and more and more where you put it.
You started holding the adjustment.
And now, months later, enjoyable for me and amazing to you, my landing gear is staying in alignment. Day in, day out, week in, week out. Along with that, however, I have listened to some of the ripping he has done on my posterior about my endeavors. He wasn't, when I was in pretty bad shape, he wasn't really thrilled when I'd spend 5 hours on my backhoe, bouncing around. He wasn't real thrilled when I'd work on a sledgehammer and concrete blocks. But that's necessary in my world. And age has nothing to do with it. I was asked the other day, don't you realize you're retired? I translate that into retarded. No, I'm not. I'm a retired retard. I live on retread. I'm a fugitive from a tire company. But anyway, I need to work. I do a scholarship I put ladies through school for certified nursing assistants. That's not free, it's not cheap. The logo on my hat is I'm an honorary member of the Seroptimus Club. They made me an honorary member about 4 years ago because they said in the previous year I had done more for ladies in this valley than they had, and they're a woman's organization. But the bottom line is, by the end of December, we will have graduated 28 ladies, and this is paid for by buying old derelict houses and rehabbing them, and then finding a needy family that can't qualify for a house, and put the needy family in the house. Now, they're paying the bills. This is not charity, folks. Put a needy family in the house, and then take the money that that house earns me and turn around and write the check and send the lady to school so that she can get off the welfare rolls. And we've been successful basically because of the man to my right. The fact that he keeps me vertical and on my feet allows me to go out and do these things that can help other people. And I appreciate his effort. I do reserve the right to rag on him every opportunity that I get, and I'm good at what I do, and I have had him speechless on more than one occasion and have insulted him greatly by some of my terminology.
We definitely enjoy LD in the office. He keeps us hopping. And you know, we run a pretty loose clinic. Everybody pretty much enjoys themselves. My background coming from pro sports and working with athletes in a training room, you know, on an open floor, you don't get real serious about anything except trying to keep people in the game. I call it keeping people in the game because that's what I did for 30 years working with these athletes, was I kept them playing. There was a time when I was with the San Diego Padres, and the orthopedist come into my treatment room and wanted to know why the ball players came to me before they would go to him. And his name was Dr. Fronick, and I said, Dr. Fronick, they come to me because I keep them playing. I don't put them on medication. I don't put them on the disabled list. I don't cut them. We find a way to keep them in the game safely, you know, without them hurting themselves anymore. Now, of course, there are some players that we ended up having to send over to see Dr. Fronick. Interesting story. He didn't take that too well because he's an orthopedist and a surgeon.
Well, yeah.
So as the story goes, about 3 or 4 weeks after that episode, he threw his back out. And he come into my training room and he said, Doc, is there anything you can do? I'm scheduled for surgery on my low back in 2 weeks. And I said, well, you know, Dr. Fronick, let's see what we can do. And about the time he was supposed to have his surgery, he was back out golfing. I subsequently started seeing every patient he had for back surgery before they had back surgery to see if we could keep them off the surgical table, and had great success.
The problem with back surgery is once they whittle on you, then in many cases afterwards it cannot be fixed.
Well, in a high majority of cases after they do the surgery, the pathology is worse.
Yeah.
And you can't undo it. Once they go in and saw the bones out and put in the cages, and I mean.
Well, a friend of mine just had back work a few months ago, and now she's going to have to go in for a cage.
Yeah, that's usually what happens.
Because that's the next step. And I have another friend in Oklahoma that has rods up through the spine to keep everything in line. And again, it's a result of operate. And my back is probably as bad as either one of theirs.
Oh, yeah.
And I'm out there lifting and working and doing. However, I do not lift and twist. I pick it up and I walk like a tottering old man and get turned around to where I need to go to set it down. It slows me down.
Well, you're old enough to slow down. Chuck.
Hey, Doc, how you doing?
I'm good. Thanks for calling. What's up tonight?
Another great show, and I just want to make a comment about some of the things you've been talking about. I had sciatica and degenerative disc and all that, similar to Lazedog, and it's the worst pain I ever went through, and that includes 2 open heart surgeries and on and on. The pain is indescribable. So anyone that is listening, please believe both of us that chiropractic and moving around to the spine, etc., to help the body heal does work. And the trouble I see so often with medicine and healthcare is, like you guys been talking about, surgery and some of the so-called cures does more to prevent the body from healing itself.
Absolutely.
And it just is such a shame for me to hear about people that don't go to chiropractors simply because of the voodoo label that's been put on them.
Well, things are much better for us now, Chuck. As chiropractors, we're much more accepted. The insurance, we accept Medicaid and Medicare. We accept almost every insurance out there, and it helps reduce the cost. We keep our costs down to people here in Pahrump because we're well aware that, everybody here in town's on a fixed income. Our goal at the Wellness Center, Dr. Reiner's and my goal is to treat patients, to get them better. I know Dr. Reiner's goal is to have another vehicle to use to help get people off of the medications that everybody's using, the opioids. Because, after 2 weeks of using those, the studies show they really don't do any good. But by 2 weeks of using them, there's a very good possibility that you've created a real habit where you've got to stay on them. So we're interested in treating our patients. We're interested in taking a more holistic approach. We're interested in wellness, in preventative measures. Come in and talk to us. Let's take a few pounds off of you. Let's get you stretching. We failed here. But it's not due to lack of effort.
Chuck, there's a possibility that your back problem is caused by your front problem.
Let me tell you what, the majority of back problems aren't low back problems, they're low front problems. What you don't realize, as we get older, our front gets a little farther out there, and our stomach muscles and how the integrity of our stomach muscles determines the strength of our low back. And once you get that through to people and they start doing things, it really helps. We have to go to a break. Chuck, stay on the line. I want to visit with you when we get off, okay?
Okay, Doc.
Thanks.